Hello, my name is Dr. George Rogu from AdoptionDoctors.com, the go-to place for international and domestic medical education for adoptive families. Today I'd like to speak to you about the important post-adoption medical examination. Why do we need it? Now, it is only through this post-adoption evaluation and extensive laboratory testing that a physician can come across conditions that we may not know about and were not reported in the adoption medical records. The purpose of this evaluation is to uncover medical conditions that may not have yet presented themselves clinically. We use this as an opportunity to rule out diagnoses or conditions that may have been suspected on the pre-adoption medical evaluation. We help to confirm the adequacy of treatments for particular ailments and to help document the cure. And we use this time to determine the child's developmental status and the vaccine immunization status. Now, some parents feel that no testing is needed. The child is healthy, it came from a good country, it came from a good orphanage, we know where they're coming from, so why bother taking tests? Well, that's not the best plan. Sometimes in the orphanages, they did receive some blood work. Sometimes we have some reports. Some parents feel that they had a visa physical examination and that most children are healthy, so there's no reason to check these children. That's not correct. Now, in regards to the visa medical examination, what is the purpose of the visa medical examination? The visa medical exam is basically to make sure that the child is breathing and does not harbor any communicable diseases that can be brought into the United States. Such diseases are HIV infection, syphilis, tuberculosis, and now COVID infections, coronavirus infections. These are all communicable diseases that can put the population at risk, so the visa exam is to help tease out those cases. This exam consists of a very brief physical examination and medical history intake. Sometimes they perform a chest x-ray on the child to make sure that they don't have active tuberculosis in the lungs, because tuberculosis is something that is transmitted through the lungs and the respiratory system, and it could be affecting other people. Oftentimes, if the child is less than 15 years of age, unless there's some kind of a medical condition, they don't even entertain this. Now, testing in the orphanages. Sometimes I do see reports that had some results of tests in the orphanages. While that is great, they should only be used as a screening tool. Some of the tests that I look for during the pre-adoption evaluation are things like syphilis, HIV infection, hepatitis B infection. These are all diseases that can be transmitted from person to person in the orphanage. And if the child is HIV positive, that does not mean he's not adoptable, but the parent that's going to be adopting this child should be made aware of it to see if their life could handle such a chronic health condition. It's not fair upon these parents to not know and then to find out in the United States that the child had a problem. The validity of these tests, however, need to be reconfirmed when they come to the United States. They should only be used as screening tools. Now, after the child arrives to the United States, when is the optimal time to get this post-adoption medical evaluation? My opinion is that the child does not need to come to the physician right away. Wait about 2 weeks. The child first needs to get accustomed to the new house, to the new family, to the new parents. I need the parents to interact and live with the child and see how the child is actually doing, to tell me something when they arrive to the office. I do also recommend that the parents immediately post-arrival avoid overstimulation on this child, avoid trips to Disneyland, avoid large gatherings, because the child, where they lived in a small secluded orphanage for many, many years, all of a sudden you take them to a place where there's a million things happening, they're just going to overstimulate and have overload. And you should also try to avoid an immediate visit to the physician's office. I've heard of parents wanting to come to see me right after they arrive to JFK Airport. That's pretty silly. Now, if the child is indeed ill with a bronchitis, an ear infection, a fever, a respiratory problem, a diarrhea, any kind of medical condition, by all means, go visit your physician and get that immediate acute problem resolved. But the post-adoption formal evaluation should not take place until about 2 weeks of age. 2 weeks post-arrival. Now, what does the post-adoption evaluation include? During the post-adoption evaluation, we're going to try to find out about the child's pre-adoption medical record intakes and discover if there were any medical conditions or any problems that need to be entertained and resolved. We will review the whatever records we have. We'll perform a complete physical examination. We will perform a developmental milestones on the child and see where they're at according to their age. Immunization records will be evaluated, and we will determine through blood work whether we continue with the vaccinations or we start from the beginning. And there's a multitude of laboratory tests that will be performed to rule out different medical problems. Now, I'd like to go over some of the tests that we will be performing. These tests are a complete blood count. Now, what does that tell us? It gives us a little bit of information about the child's blood. It'll tell us if the child has some anemia from chronic disease, iron deficiency anemia from malnutrition, sickle cell disease, thalassemias. We'll also check the lead status of the child, because lead is the #1 cause of developmental delays in untreated children, and you can often find lead paint in the old institutional walls, in the water supply, the pipes. There's sometimes the overall environment could be have this lead pollutant. G6PD deficiency is a rare thing, but it does often occur in children born in Asia, Africa, and in the Mediterranean region. It's a deficiency in an enzyme that can cause basically hemolytic anemia disease, where the blood cells break down. We need to look into this. We'll do a hemoglobin electrophoresis, which checks for different types of thalassemias. Very, very important, HIV, because that checks basically for AIDS. If the child is HIV positive, then we need to get the child the appropriate medications and visits to the appropriate specialist. VDRL checks for syphilis, which is frequently transmitted from a mother to child. The hepatitis B panel will help us to determine whether the mother transmitted hepatitis B to the infant, or it will help us with the immunization status of the child. Checking for hepatitis C, another disease that's transmitted from the mother. Other blood tests that we like to look at are calcium and phosphorus, because through that we'll check to screen for rickets. A urinalysis we'll use to check the kidney function. We'll do a multitude of stool specimens to check for different types of intestinal parasites, Giardia infections, which are very, very common in institutions. Many children don't grow well, they have chronic diarrhea, and Giardia is a waterborne parasitic infection, easily treated with a medication in the United States. Different stool cultures will be ordered to check for intestinal bacteria. Routine comprehensive metabolic panel, which is a multitude of different blood tests, which will give us some information about the child's liver functions, kidney functions, electrolyte status, and the overall medical condition of the child. We'll check for routine thyroid to look out for thyroid disease, and we will perform a PPD, which will check for tuberculosis. Immunization titers are very important because we need to check the status and to see where we need to start, restart, continue, or go from the beginning. Some final thoughts on testing and post-adoption evaluation. As you can see, there will be a lot of blood drawn from these children. It is very stressful for both the parent and the child. I would recommend that these blood draws be performed over 2 visits, because a lot of blood needs to be drawn, and it should be spread out over a week's time. Once again, if there are any questions, feel free to email me, and my name is Dr. George Rogu from AdoptionDoctors.com, the go-to place for domestic and international adoption medical education. If there's ever a need for medical records evaluations or medical education, visit our website and we'll be there to help. Ladies, let's go.